Glycopeptides are a class of antibiotics primarily used to treat serious infections caused by gram-positive bacteria, particularly those resistant to other antibiotics. The most commonly used glycopeptides are vancomycin and teicoplanin. Key glycopeptides: 1. Vancomycin. 2. Teicoplanin. Mechanism of action: glycopeptides inhibit bacterial cell wall synthesis by binding to the D-alanyl-D-alanine terminus of cell wall precursor units. This binding interferes with the cross-linking of peptidoglycan chains, which is essential for cell wall structural integrity, leading to bacterial cell lysis and death. Spectrum of activity: glycopeptides are effective against a variety of gram-positive organisms, including Staphylococcus aureus, including methicillin-resistant S. aureus (MRSA), Streptococcus species, Enterococcus species, Corynebacterium species, Clostridium species, including C. difficile. Clinical uses: vancomycin, often used for MRSA infections, severe infections in patients allergic to beta-lactams, and Clostridium difficile colitis, oral vancomycin. Teicoplanin, used similarly to vancomycin, often preferred in Europe. It has a longer half-life, allowing for less frequent dosing. Pharmacokinetics: vancomycin, administered intravenously for systemic infections. Oral vancomycin is used for C. difficile colitis. It has a variable half-life depending on renal function, typically requiring multiple doses per day. Teicoplanin, administered intravenously or intramuscularly. It has a longer half-life than vancomycin, which permits once-daily dosing. Side effects: nephrotoxicity, particularly with vancomycin, especially at higher doses or in combination with other nephrotoxic drugs. Ototoxicity, hearing loss, though less common. Red man syndrome, a histamine-mediated reaction to rapid vancomycin infusion, characterized by flushing, rash, and hypotension. It is managed by slowing the infusion rate and pre-medication with antihistamines. Phlebitis, inflammation of the veins at the injection site. Dosing considerations: renal impairment. Both vancomycin and teicoplanin require dose adjustments in patients with renal impairment. Therapeutic drug monitoring, TDM, especially for vancomycin, to ensure effective and safe plasma concentrations. The target trough concentration for serious infections is usually 15 to 20 micromilliliters. Resistance: vancomycin-resistant Enterococci. Some Enterococcus species have developed resistance, often necessitating the use of alternative agents. Reduced susceptibility in Staphylococcus aureus, known as vancomycin intermediate S. aureus, VISA, and vancomycin-resistant S. aureus, VRSA. Clinical considerations: combination therapy, sometimes used in combination with other antibiotics to broaden the spectrum of activity or to provide synergistic effects. Monitoring: renal function, hearing tests, and serum drug levels for vancomycin should be regularly monitored during therapy. Conclusion: glycopeptides remain a critical tool in treating serious gram-positive infections, especially those caused by antibiotic-resistant bacteria. Careful monitoring and appropriate dosing are essential to maximize efficacy and minimize toxicity.